Arthritis is a condition that affects millions of people worldwide, causing chronic pain, stiffness, swelling, and reduced mobility. The most common types are osteoarthritis, rheumatoid arthritis, psoriatic arthritis, and gout, all of which involve joint inflammation. Though arthritis can be influenced by genetic factors, age, and injury, diet also plays a critical role in either alleviating or exacerbating symptoms. The food choices we make every day can influence the body's inflammatory processes, meaning that certain foods can trigger flare-ups or worsen chronic inflammation. By making conscious dietary choices, you can manage arthritis more effectively. In this article, we'll dive into 5 of the most dangerous foods for arthritis, which can contribute to increased inflammation, joint pain, and overall discomfort. Cutting back on these inflammatory foods may help you achieve better pain management and improve your quality of life.
1.
Added sugars. Sugar is one of the most problematic foods for individuals with arthritis. While sugar itself doesn't directly cause arthritis, its impact on inflammation and overall health is significant. Foods high in added sugars, like candy, baked goods, soda, and even many processed foods, can trigger the release of pro-inflammatory substances called cytokines, which can worsen arthritis symptoms. Why sugar is bad for arthritis. Consuming sugary foods and drinks raises blood sugar levels, leading to increased production of advanced glycation end products, AGEs. AGEs are harmful compounds that are formed when proteins or fats combine with sugar in the bloodstream. These compounds can provoke inflammatory responses, contributing to the wear and tear on your joints. This inflammatory process is especially harmful for people with osteoarthritis, as the cartilage in their joints is already compromised, and added inflammation accelerates joint degeneration. Another concern with sugar consumption is its connection to weight gain. Excess weight puts additional stress on weight-bearing joints such as the knees, hips, and spine. For every pound of excess body weight, there is about 4 pounds of extra pressure on your knees, which can lead to faster cartilage breakdown and more pain. How to reduce sugar intake. To limit your sugar consumption, start by reading food labels carefully. Many foods contain hidden sugars, especially processed foods, sauces, and dressings. Opt for natural sweeteners like stevia or monk fruit, and try to satisfy your sweet tooth with fresh fruit instead of desserts or sugary snacks. Drinking water or herbal teas in place of sugary beverages like soda or juice is also a great way to reduce your sugar intake and support joint health.
2.
Gluten. Gluten is a protein found in grains such as wheat, barley, and rye. For most people, gluten is harmless, but for those with gluten sensitivity or celiac disease, it can trigger an immune response that leads to inflammation. While gluten sensitivity is not directly linked to arthritis in everyone, individuals with autoimmune conditions like rheumatoid arthritis, RA, may be more prone to experiencing inflammation from gluten consumption. Why gluten can be dangerous for arthritis. In autoimmune diseases such as rheumatoid arthritis, the immune system mistakenly attacks healthy tissues, including the joints. This causes inflammation, pain, and swelling. Some studies suggest that there is a higher prevalence of celiac disease or gluten sensitivity among people with RA. For these individuals, consuming gluten can worsen their arthritis symptoms by triggering systemic inflammation. There is also emerging evidence that people without diagnosed celiac disease, but who experience non-celiac gluten sensitivity, NCGS, may benefit from reducing gluten in their diets. Though research is ongoing, many individuals with arthritis have reported improvements in joint pain and inflammation after eliminating gluten from their meals. How to manage gluten intake. If you suspect gluten may be affecting your arthritis symptoms, it's essential to speak with a healthcare professional before making any dietary changes. A blood test or biopsy may be necessary to diagnose celiac disease or gluten sensitivity. If you decide to try a gluten-free diet, focus on whole foods like fruits, vegetables, lean proteins, and naturally gluten-free grains such as quinoa, rice, and oats. Make sure they're certified gluten-free to avoid cross-contamination.
3.
Processed and red meats. Processed and red meats are some of the worst offenders when it comes to inflammatory foods. These meats include bacon, sausage, hot dogs, ham, and other deli meats, as well as red meats like beef, pork, and lamb. While these meats can be a good source of protein, Their high levels of saturated fats and advanced glycation end products, AGEs, make them inflammatory for those with arthritis. Why processed and red meats are harmful? The link between processed and red meats and inflammation is well documented. Red meat is high in saturated fat, which can increase levels of inflammatory markers in the body, such as C-reactive protein, CRP, and interleukin-6, IL-6. These markers are commonly elevated in people with arthritis and can exacerbate joint pain and stiffness. Moreover, processed meats contain preservatives, nitrates, and other additives that may further stimulate inflammation. The cooking methods used to prepare these meats, such as grilling or frying at high temperatures, can also produce advanced glycation end products, which, as mentioned earlier, contribute to inflammation and oxidative stress in the body. Alternatives to processed and red meats. Opt for lean protein sources like fish, chicken, turkey, or plant-based proteins such as beans, lentils, and tofu. Fatty fish like salmon, mackerel, and sardines are particularly beneficial because they are rich in omega-3 fatty acids, which are known to reduce inflammation. Incorporating more plant-based meals into your diet can also help reduce the overall inflammatory load on your body, supporting better joint health.
4.
Alcohol. Alcohol can be both friend and foe when it comes to health. In moderation, some studies suggest that certain alcoholic beverages, like red wine, may offer anti-inflammatory benefits due to compounds like resveratrol. However, excessive alcohol consumption is linked to increased inflammation and can worsen arthritis symptoms. How alcohol worsens arthritis symptoms. Alcohol is known to increase the production of uric acid, which can lead to gout, a painful form of arthritis that occurs when uric acid crystals accumulate in the joints. Gout causes sudden and severe attacks of joint pain, often in the big toe, and is closely related to lifestyle factors, including diet and alcohol consumption. For people with rheumatoid arthritis or osteoarthritis, drinking alcohol can interfere with medications commonly used to manage arthritis symptoms, such as nonsteroidal anti-inflammatory drugs, NSAIDs, and disease-modifying antirheumatic drugs, DMARDs. Alcohol can reduce the effectiveness of these medications and increase the risk of side effects like gastrointestinal bleeding or liver damage. How to manage alcohol consumption. The key to managing alcohol in your diet is moderation. Most healthcare guidelines suggest that men should limit alcohol to 2 drinks per day and women to 1 drink per day. However, if you notice that alcohol consistently worsens your arthritis symptoms, it may be best to avoid it altogether. Choosing alcohol-free beverages like sparkling water, herbal teas, or mocktails can help you enjoy social occasions without exacerbating joint pain.
5.
Nightshade vegetables. Nightshade vegetables, including tomatoes, potatoes, eggplants, and bell peppers, have long been the subject of debate in the arthritis community. These vegetables contain a chemical compound called solanine, which is suspected of aggravating arthritis symptoms in some people. Though scientific evidence is mixed, many individuals with arthritis claim that reducing their intake of nightshade vegetables helps ease their joint pain. Why nightshades may be problematic. Nightshades are part of the Solanaceae family of plants, which produce solanine, a natural pesticide that protects the plant from predators. Some people believe that solanine can also promote inflammation in the human body, especially in people who are sensitive to it. Although there is no definitive scientific proof that nightshade vegetables cause or worsen arthritis, there is anecdotal evidence suggesting that some people experience flare-ups after consuming them. Nightshades are also a rich source of nutrients, including vitamins A and C, which are beneficial for overall health and immune function. Therefore, eliminating them entirely without medical advice may not be necessary unless you experience noticeable joint discomfort after eating them. How to experiment with nightshades. If you think nightshades might be affecting your arthritis, try an elimination diet for 2 to 3 weeks. Remove all nightshade vegetables from your diet during this period and monitor your symptoms. If you notice a significant reduction in joint pain, you may have a sensitivity to solanine. After the elimination period, gradually reintroduce these vegetables to see if your symptoms return. Always consult with a healthcare professional before making major dietary changes, especially if you have underlying health conditions. Conclusion: take control of your arthritis through diet. While no single food causes arthritis, certain foods can trigger inflammation and worsen joint pain. By avoiding these 5 dangerous foods, added sugars, gluten, processed and red meats, alcohol, and nightshade vegetables, you can reduce inflammation and help manage your arthritis more effectively. Remember, everyone's body reacts differently to foods, so it's important to listen to your body and work with healthcare providers to create a personalized dietary plan. With the right approach, you can alleviate your symptoms, protect your joints, and improve your overall quality of life.